Hi, my name is Dr. Ali Parisi, and I am a prenatal and pediatric chiropractor down in Palm Beach Gardens, Florida. And today I will be presenting on galactosemia and the spine. So, as a chiropractor, I work with a lot of children, not just because they have neck and back pain, but there are other underlying neurological conditions that I see on a regular basis. One of them being galactosemia. And I will go over sort of the outline of the connection here between chiropractic and galactosemia. So what I'll be talking about today first is my background and how I got sort of led to the whole Galactosemia Foundation. I'll also talk about common neurological impairments in children with galactosemia, understanding the nervous system, because it is a common misconception that chiropractic only deals with neck pain, back pain, musculoskeletal sort of conditions, but really we're mostly concerned about the nervous system and how the body is functioning. So I will be talking about that. And then, of course, the connection between chiropractic and these impairments that I'll be discussing, the research and results that we've been seeing in my office and on a national and global level, as well as the resources to where I, found all the information for this presentation and resources for you as parents to really help your kids. So first off, I have a twin brother who has galactosemia. His name is Adam. And so this is something I have, been around my entire life. We're 38 years old now. So I have seen everything that my parents have learned throughout the years, throughout childhood, and now having a brother with galactosemia as an adult. So we have adapted and evolved a lot over the past 38 years. When my brother was first diagnosed in the early 80s, my mom didn't really know anybody who had galactosemia. It was very rare at the time, very unknown. We didn't have the same internet and social media as we do now to be able to navigate this. So she reached out to some of the nurses in the hospital and she wrote letters. And she just asked the nurses, can you please mail these to any other parents who have kids with galactosemia? And they ended up meeting up. I believe it was like 4 moms. And my mom founded the Parents of Galactosemic Children at the time. And it really has grown. Now it's the Galactosemia Foundation. So some of you may know my mom. Her name is Linda Leggio, formerly Linda Manis. And she really kind of paved the way to bring more awareness and help these parents, because having a child with such a rare condition is difficult. And so, I can't speak to that part about being a parent, but, as a sibling, I have seen it all and I've been through it all. So moving on about my background, I went to the University of Florida. I majored in psychology, but I knew I wanted to go in the medical route. So I just wanted to kind of be well-rounded with, being a chiropractor in the health field. And then I went on to get my certification in pediatrics and prenatal chiropractic. And that's what the majority of my practice is. I would say about 80% is prenatal and pediatric. I've done some of my own case studies on my patients. And I also participate in the practice-based research network, trying to just get more research on chiropractic because it's kind of lacking. And so we're doing our best to sort of collect as much evidence as possible, because a lot of us chiropractors, we see so many positive things going on in our practice, and we just want to share that and let people know that this is a great non-invasive option for families. And then Upper Cervical Research Foundation, I'm going to talk about that in a little bit as we get through the presentation. So diving right in, some neurological impairments that we'll see in galactosemia are learning disabilities. Now, really, this is just the brain's inability to receive, process, store, respond to, and communicate information properly. This can affect, things in school and at home, like listening, speaking, all the things that are listed here, where there might just be some sort of delay because the neural pathways are not firing the same way as they would in, what we call a neurotypical type of child. So something you can look for early on, I realize some of you have older children, but some of you that still have babies or toddlers, you can absolutely keep an eye out for some of these developmental delays, like learning to roll over, sit up, crawl, talk, walk. So all of these things will be affected by learning disabilities and, impairments with the nervous system. So in my office, I see a lot of babies and children with delays in some of these important milestones. I know that that is common in galactosemia. I remember my brother sort of crawling and walking and talking a little bit later than me. Now, we had like a built-in evidence-based research control sort of thing going on because I'm his twin. And so my parents could see like what a neurotypical child was doing compared to a child with galactosemia. And yeah, so it's not going to be the same for kids that have galactosemia. It will be a little bit delayed most of the time. Something else we see in kids with galactosemia is decreased motor skills. So lack of coordination. There's gross motor skills, which are like big movements, like waving your arm. Also later on, that's like riding a bike and things like that. Fine motor skills, you're going to see more like picking up food with their hands and picking up small objects, being able to fit something in a small hole, like things like that. Like scissors, cutting with scissors, that's a common fine motor skill. Holding a pencil or pen or crayon. And so we are going to see delays with this. These are all neurological impairments, something we see that is common with galactosemia and, other kids as well. So things we want to look for, like I said, I know some of you have older kids, but if you do still have babies, you can start keeping an eye out for these things now. These are signs of decreased motor skills. So by 3 months, they should be able to hold up their head. They should be able to kind of push themselves up a little bit on their forearms if they're laying on their tummy. And they should start bringing their hands to their mouth, objects to their mouth, feet to the mouth, things like that, and start reaching for objects. Like if you put something out in front of them when they're on their tummy, they should start reaching for it. So those are just, things to look out for by 3 months. By 6 months, we want to see that they roll over both sides from back to tummy and tummy to back. And then we also want to see that they're following objects with their eyes. There are other milestones, like at 6 months, I usually like to see that babies are sitting up unassisted by then. Some are a little before, some are a little after. And then as they get a little bit older, they'll start crawling between 6 to 10 months. Tremors are another very common condition. This is something that my brother has always had as long as I can remember. And these are unintentional trembling or shaking with movement. It can affect not just the, arms and hands, which is what we normally think of with tremors, but it can affect like your head and even your vocal cords when you're speaking as well. Things that make it worse are stress, exhaustion, if you're tired, and older, adults, sometimes alcohol can make it worse. And so it is important to keep an eye on this because tremors can be definitely interfering with your everyday life. I know it's very stressful for my brother. It's frustrating for him. He wants to be able to move around in a smooth, easy way, and his body is just not able to do that. So this is a very tough one, in my opinion. I think I already went over this. It can happen a lot, especially if like they're trying to concentrate. So like if you're trying to bring the fork up to your mouth, it can definitely cause a tremor on the way to your mouth. That's very common with writing or drawing. And with, balance and gait too, like you have to watch your kids, be very careful going up and down stairs and things like that. So what is the connection between chiropractic, or I should say the nervous system, and all of these impairments? Well, they are neurological impairments. So it's the nervous system that is the issue. Now, the brain is what is controlling everything in our body. And what you may not be familiar with, or maybe you are, is the brain stem. So the brain stem sits right below the brain. It is actually right in between the first and second bone of the neck, which we call the upper cervical area. And the brain stem is the first organ, the first thing that's ever formed in the human body. So the brain stem is formed first, and then the brain comes out from the top, and then the spinal cord comes out the bottom. And the brain stem is so important because that's where all of our autonomic or automatic bodily systems take place. So our breathing, digestion, our heartbeat, these are all controlled by the brain stem, things that we don't have to think about. So if you remember Christopher Reeves, he broke his neck, which was that first bone in the neck, the upper cervical area. It severed his brainstem, and he had no bodily functions after that. And that's why it's so, so important to keep the brainstem clear. Now, obviously, if you have a misalignment in the spine, which I'll get into in a little bit, that's not going to cause complete impairment like Christopher Reeves, but it can interfere with the nerve signals going from the brain and the brainstem to the rest of the body. And that can cause issues and dysfunction with some of your major organs. So one thing that's important about nerve cells is they cannot regenerate. We know that if you get a cut on your finger, like a paper cut, it will heal, right? It's going to take maybe a few days. If you have a deeper cut, maybe a little longer, but eventually it's going to heal because your body regenerates its cells and it heals it. And it does the same thing inside your body as well. It's always possible to heal things from the inside out. However, nerve cells cannot regenerate. And that's why Christopher Reeves was never able to be completely healed, because you cannot, once the brainstem or part of the nerve is severed completely, it cannot be regenerated. The body can't do it because it's the first thing ever formed, and that's what's controlling everything else. So it's really, really important to take very good care of your nervous system because we only get one. So I already sort of went over this. The brainstem is super important. Harvard Medical School research even said when the brainstem is functioning at 100%, it is capable of healing any disease known to man. So again, very, very important. You can see the brain here in orange and that little piece sticking down into the top two bones of the neck, that upper cervical area, that's the brainstem. It's very small. It's like the size of your thumb, but super, super important. So again, this is the upper cervical area. The area that's circled is where the brainstem is. So the whole spine is made up of 24 movable vertebrae. What's unique about the spine and the upper cervical area is that there is no disc. So if you are familiar with anatomy of the spine, or if you're not, I will tell you, but in between each of the 24 individual vertebrae, there are discs, and those are like cushions. And so when we're moving around or we're jumping and things like that, there's a cushion in there. It's almost like a jelly-like substance. You've probably heard of a bulging disc or herniated disc. That's when that disc gets smushed down. And sometimes that can put pressure on the nerves, which can cause pain. It can cause numbness, tingling, sharp shooting pains and things like that. But in this upper cervical area, there is no disc. So it's bone on bone on bone. So the second bone there, or I'll say, see where the skull is, right below that is C1, that's the atlas bone, first bone of the neck. And then the second one is C2, that's the axis bone. So between those joints, there is no disc, so no cushion at all. We're freely movable. That's how we have so much range of motion in our neck, from moving left and right and side to side and all around, is at that joint up at the top there. So that's very important, because if there is no disc, that means that those bones cannot degenerate. When I say degenerate, that means wear down. So discs over time will wear down. everywhere else in the spine, because it's just what happens in a weight-bearing species. The discs just start to degenerate, and that's what leads to arthritis and things like that. But the top two bones of the spine, you cannot have arthritis there because there's no discs, so they're not going to degenerate. Now we can have other things there, like congenital anomalies, or you can have looser ligaments up there. That's something common that we see with people with Down syndrome, for example. But as far as I know, there's no uniqueness to a child with galactosemia spine compared to a neurotypical child or adult. A subluxation is what chiropractors are looking for to see if there is a misalignment in the spine. This can put pressure on the brainstem. It can also put pressure on the arteries that are sending blood to the brain. So if there's a decrease in these nerve signals from the brain to the rest of the body and from the rest of the body to the brain, it's a miscommunication, right? There's dysregulation because the signals are not getting where they need to go at 100%. Maybe they're getting there at 80%, but to me, that's still not great, because that means the organs are not going to be functioning at 100%. And we want everything functioning on all cylinders to help our kids and to help us live optimally and be functioning at 100%. So causes of subluxation. Now, this can happen with anybody. This, excuse me, causes, excuse me, causes of subluxation can be from birth, whether it's like the most beautiful, smooth vaginal birth you've ever seen or been through in your life. Still, it can put a lot of pressure on the baby's head and neck, a lot of compression, and that can cause that first misalignment in the baby's upper cervical area. Also, how they were positioned in utero. I see a lot of babies coming in with torticollis, which is when they kind of have their head turned or leaning to one side. That can be caused by how they were positioned in the womb for, the 9 months that they were in there. The muscles will kind of get stuck in that position if it's not corrected right after birth. Also, things like learning to walk, falling over. If you have young kids, I have a 5 and a 2-year-old, so I know falls and slips and injuries and accidental, hitting someone, things like that happens all the time. Falling off your bike and all that, scooters. So, there's definitely going to be some jarring and some misalignments in the spine from when they're born through all of development. And the reason that chiropractic is so important for kids, not just for galactosemia, but for all kids, is because it sets the foundation for the spine. So we all brush our teeth every day, I hope, and we see the dentist to make sure we don't have cavities. And that's great because we all have pretty good oral health probably. But what are we doing to take care of our spine and our nervous system? We know the nervous system controls everything in our bodies, so we really should be taking better care of it, right? Now, as far as chiropractic adjustments go, they're very gentle and safe. The way that I practice, I can't speak for all chiropractors, of course, but I don't do any twisting, cracking, popping, or jerking of the neck. I use objective findings. We use like thermography. We check posture. We check your body balance every single visit. Sometimes we do x-rays, just kind of depends on the situation. I don't love x-raying kids, but sometimes it's necessary. And we try to be as specific as possible. So this is not like a gross manipulation where we're just racking and cracking everything in your body. We are looking very carefully at each individual vertebrae and adjusting it to its aligned position. So some of the studies that we have seen in chiropractic have helped with some of these conditions listed here. Now, obviously, galactosemia is not going to be listed here because it's very rare and nobody is really looking into chiropractic and galactosemia, but we do know a lot of the things listed here are common conditions or impairments with kids with galactosemia, such as tremors, infertility, immune function, ADHD, things like that, speech disorders. So this is all stuff that we've seen improvement with because, like I said, this is not chiropractic. I'm not here to tell you it's going to cure every single impairment that your child has, but what it will do is just help them function at whatever their best is. And so they may not be like 100% neurotypical and be 100% in all of these areas, but they will be 100% for their body. So results that you can expect from adjustments, the younger the child, the more immediate the results. Again, that goes back to setting the foundation. If a child has a misalignment from the position they were in the womb or the birth process in general, this can cause those misalignments, but adjusting them will set the foundation. It's like building a house. You want the foundation to be completely balanced and even. If it's not, then when you build the house on it, it's going to crumble and fall down quicker. It's going to wear down quicker, right? So with adjustments, if we start out young, we're building a solid foundation so that as they grow and develop and they have more injuries and they're playing sports or they're in school and they're at a computer and on a phone and doing all of these different things that are going to inevitably affect their spine and nervous system, they're going to be able to adapt better because their body is more balanced. Damage to the spine takes years to develop. So that's why the sooner it's corrected, the more healing can occur. So I see a lot of adults in here as well. A lot of parents will end up coming in after they bring their kids in because they've seen good results. And it's never too late to get adjusted. However, the younger you start, the less damage there's going to be to work with. It's more preventative. If there is permanent nervous system damage, you could still see improvement. However, there's going to be a limitation. There's something called limitation of matter. So we can't change the matter that's already damaged. But what we can do, as I mentioned before, is help your body function at 100%. So here are some pictures of me adjusting kids. These are just a couple of different babies. The one on the left is a little newborn. You can see it's super gentle. I'm just using light touch to adjust a younger baby. It's really only about the same amount of pressure you would use to test the ripeness of a tomato or an avocado. And to adjust like an older baby, like the one on the right, he was probably like, I don't know, 6 to 8 months in this picture. To adjust an older baby, it's still super light, and I use a couple different tools to assist in the adjustment. So there's never going to be any cracking or popping or anything aggressive at all. Another thing that's not pictured here is I do adjust a lot of babies and kids on their moms or dads. And so it's not going to be scary. I mean, I can't speak for every single chiropractor out there, but in our office, if a baby or child is crying, if they're upset, if they don't want to be adjusted that day, I will wait and I'll ask the parent what they want to do. And I will let them hold their child the entire time if that's the only way to adjust it. So I'm on the floor, I'm kind of getting in mom's space trying to adjust these babies, and you know, we'll do what we can to try to get them adjusted and on the right track. So here are some references and resources where I found the information. And then here's my contact information. So this is my email, my phone number, website, Facebook, and Instagram. You can contact me through any of these ways, and I promise you will get a response back from me. I definitely recommend, if you're interested in chiropractic care, I would recommend going to the ICPA website. I'm going to bring that right back up real quick again. It's the one at the bottom here. It's ICPA, the number 4 kids.org. If you click on find a chiropractor, you will be able to go search your area and location to see if there's someone in your area who's certified in pediatric chiropractic. Now, what you want to look for, which would be ideal, is the CACCP letters behind their name, or DACCP. Honestly, the more letters behind their name, the better, because that's the more certification and the more training and the more experience that they have. So that's something to look for. However, anyone that's on the directory will be, a good fit. And if you have any questions or you want to know if I know them personally, you can reach out to me, and I can help connect you. Again, here's my contact information if you want to write that down or, contact me in any way. I have really enjoyed working with the Galactosemia Foundation for the past few years. I really enjoy, helping other families, like my family has been helped. I love the connection that it brings for parents. And I actually had a patient who was diagnosed with galactosemia as a newborn, and it was so, you know, so refreshing and so like supportive for the mom to know that I was familiar with that and I knew exactly what she was going through and I knew what it was. So she didn't have to explain it to me because I know how isolating it can be to have a child or, family member with galactosemia, and people just don't understand, even your doctors. So if you have any questions, again, please contact me. And this was a pleasure, and I hope to see you all soon. Thank you.